Hey guys, this is Dr. M, your clinical nutritionist, functional medicine, and acupuncture physician. So there's just an overwhelming amount of information out there. And the question is, who do you trust? What or who do you choose to believe? From my point of view, the World Health Organization and the Center of Disease Control, the CDC, have the most accurate information in tracking this virus. And I'm hearing a lot of talking points, even in the healthcare community, that just get repeated when we really don't have a valid source for that piece of information, or it may be someone's opinion that's not based on anything factual. So really I made this video because I just wanted to do a little clarification and a review on how COVID-19 is different from the flu and therefore needs to be treated a little bit differently in regards to our social distancing behaviors. So before I even go into those differences, I want to reiterate that this in no way undermines the seriousness of the flu. The CDC reports that the flu kills 23,000 to 59,000 people in the United States each year, and this is a huge problem. Many people get sick from the flu, and if you have the flu, you should be taking it seriously just as we are taking the COVID-19 seriously and doing your best not to get other people sick. The difference here with this new COVID-19 virus is that it infects 2 to 2.5 times more people than the flu. The average flu patient spreads the flu virus to about 1.3 other people. The average COVID-19 patient will spread the virus to at least 2 to 3 times more people on average. And statistics are now showing that number may be much higher than we originally thought. So there are 3 major reasons why COVID-19 is spreading more rapidly than the flu. The first reason is due to the incubation period. You can be carrying the virus for up to 14 days or maybe even more and be asymptomatic. And during this time, you are contagious. In contrast, the flu is contagious within the first 3 to 4 days when you actually have symptoms. This is typically when you don't feel well and are already staying at home and not subjecting others to those symptoms that you're experiencing. So with the coronavirus, you're more likely to be spreading this without even knowing it when you don't have symptoms. And the second reason is why COVID-19 is so contagious is that research now shows that the virus can live for hours and even up to days on different surfaces that it lands. It can exist in the air up to 3 hours on aerosols, can live up to 4 hours on copper, up to 24 hours on cardboard, up to 2 to 3 days on plastic and stainless steel. So this is a major concern. So suppose that you're asymptomatic and that incubation time during those 1 to 14 days, you may really not know what you've personally left behind on a surface for the next person to catch. And that really brings me to what I feel is the most important point. The most vulnerable population is those over 60 years old and anyone dealing with a chronic condition. That's an autoimmune condition, a chronic infection, anything else that would be deemed a pre-existing condition, for example, diabetes, insulin resistance, obesity, and heart disease, which scientists have identified as major risk factors for not being able to overcome COVID-19. These are conditions that over half the American population are collectively dealing with already. These people could be your UPS driver, your banker, your teacher, your own doctor, your healthcare provider, your mom, your best friend, and the list goes on and on. So let's be kind to one another. Let's consider one another and consider the impact of our own behaviors so that together we can get through this with the fewest amounts of deaths, the fewest amounts of scrapes, bumps, and scars that we can. So let's not panic. Instead, today we're called to have more awareness of our own behaviors and thoughtfulness to others in our lives and those people that help make our world go round. And what I want you to know is that there are many things that we can do to help our own body's ability to adapt to this situation so that we can optimize the best possible outcomes even if we do get sick. So please stay tuned for my next video on the top 5 things you can be doing at home to keep you and your family safe and healthy. From my family to yours, wishing you a healthy day and many more days to come.